global health concern that's been flagged by the World Health Organization. Now, 9 cases of monkeypox have been reported so far in India, and a national task force has been constituted to monitor the development of diagnostics as well as vaccines vis-a-vis monkeypox. Union Health Minister Mansukh Mandviya today informed the Rajya Sabha that steps are being taken on the part of the government to prevent the spread of the disease and to develop testing kits as well as vaccines. Airport and health officers have been instructed to remain absolutely vigilant and undertake rigorous health screening of incoming international passengers. The National Institute of Virology in Pune has been designated as a referral laboratory for testing suspected cases in relation to monkeypox, and in addition, 15 other ICMR-linked laboratories have been optimized to undertake diagnostic testing for the monkeypox disease. Central teams have also been deployed on the detection of confirmed cases to affected districts to assist in and control containment efforts in this regard as well.
और मंकी पॉक्स डिसीज के संदर्भ में भी पब्लिक अवेयरनेस बहुत आवश्यक है। भारत सरकार की ओर से नीति आयोग के मेंबर के अध्यक्षता में हमने एक टास्क फोर्स भी बना दिया है। टास्क फोर्स के आधार पर वो समय समय पर उसका आकलन करते, स्टडी करते, मैंने भी और सभी स्टेट गवर्नमेंट को लेटर भी लिखा है, तब जाके अपने स्टेट में भी उसके अवेयरनेस के कार्यक्रम चलाए, पब्लिक को अवेयर करें। कई एक्सपर्ट लोग भी टेलीविजन के माध्यम से पब्लिक अवेयरनेस करके डीप कॉन्टेक्ट से ऐसे कोई संदिग्ध केस है तो उससे दूर रहे। दूर केवल इतना ही रहना है कि उसके जो नजदीक के लोग हैं वो उसके अंतर बनाए रखे, बाकी घबराने की आवश्यकता नहीं। कई बार ऐसा होता है कि कई लोग ज्यादा बोलने से, ऐसा तैसा बोलने से पब्लिक में एक फियर आ जाता है, डर आ जाता है। एक केस के मंकी पॉक्स के संदर्भ में डरने की कोई आवश्यकता नहीं है। भारत सरकार की ओर से स्टेट गवर्नमेंट के साथ कंसल्टेशन करके, बातचीत करके पब्लिक को स्टेट कंट्री में अवेयरनेस किया जा रहा है ताकि एक डिसीज को आगे बढ़ते हुए हम रोक सकें।
This patient is from African subcontinent, and this patient had history of fever with the skin eruptions. He has maculopapular and vesicopustular rashes over the thighs, over the face, and over the anterior chest wall. Right now he has low-grade fever and he has skin lesions. We have kept him in the isolation facility, and a team of experts is taking care of him. Right now we have one positive confirmed monkeypox case from the Nigeria, and we have 2 suspected cases. And we have sent the report, and we expect that the report may reach us in next 48 hours.
Now, that was a reference, of course, being made there about a Nigerian national who's contracted monkeypox and has been admitted in hospital here in India. We're joined right now by Dr. Subramanian Swaminathan, the Director of the Infectious Diseases and Infection Control at Gleneagles Global Hospitals. Thank you so much for speaking to us, Dr. Swaminathan. Now, first and foremost, what are the symptoms of monkeypox that one should look out for before getting tested?
So monkeypox is primarily a cutaneous illness where a person can have fever and blisters, especially on the extremities, the hands and the feet, can have lesions on the face as well. Obviously, it's very easy to confuse this with other blistering illnesses, especially chickenpox. The difference is that the blisters here are far larger. But it's also important to understand that you're not going to get monkeypox unless you've been exposed to somebody who has had monkeypox. So we are primarily interested in people who are coming from overseas and in people who have had recent contact with people who have already had monkeypox. So unless you have all of this going together, the chance of a person having monkeypox is astronomically low.
Now, the cases in India, as far as monkeypox is concerned, are steadily rising. How real is the threat of this spreading, like a pandemic? That's one alarmist situation that one foresees. But what's really the status with respect to how it's spreading here in India?
Well, the WHO has acknowledged that monkeypox is being reported almost every continent and so many more countries right now. So I think we are still trying to find out the magnitude of the problem. It's too early for us to say how bad it is. But what we can say is this. The monkeypox issue has been going on for nearly a couple of months now, but in spite of it, it has not blown out of proportion, just like, say, COVID did. So obviously, it's something that is moving slowly and steadily. So there's no reason for us to lose our peace of mind over this and start panicking. But certainly it is something that we need to be concerned about and continue monitoring the situation. It's also important for people to know that it's not something that is a very dangerous virus and that it causes too many deaths or something. Deaths are fairly rare. But we need to get to the bottom of it to see exactly how much transmission there is and whether we are different from the Western world in terms of the strain and things like that. So a lot of work needs to be done for us to be able to say for sure exactly where we stand and how bad it is. But at this point, it's not so bad.
And what's the treatment, Dr. Swaminathan, as far as monkeypox is concerned, in order to not just cure it, but also treat it? Now, if those afflicted by monkeypox, what kind of treatment do they normally go through? What's administered?
Okay. So for the overwhelming majority of people, the virus is practically self-limited. It will happen and it will get better. Most of the problems are being noted in people who have very, very poor immune system due to either cancer or some other medical problem. So the good news is most people don't need any specific medical therapy. Finally, it's also important to remember that we don't have any approved medicines which have been tested in a very large scale. There is a lot of drugs which are being looked at because there is in vitro, meaning test tube level data or limited clinical data. But I think it's too early for us to say, let's give this medicine or that medicine. Good common sense care is probably all that is required for most of the patients.
And a final question now, Dr. Swaminathan, how does India address this situation? It's now constituted a task force to deal with monkeypox. What do you think are its immediate priorities?
The first thing is understanding the magnitude of the problem. I think it's important to decentralize this and set up testing facilities at every region, possibly every state, so that the diagnosis can be done faster and cases can be identified faster, so that contact tracing can be done and it can limit the spread of the disease. That is very, very important because this is one place where contact tracing can really make a difference. The second thing is we need to do genotypic studies to find out if the strain and the variant which is going around in India is very similar. Early data seems to suggest that we may be different. So I think we need to get more data on that and see if there is some difference in what is happening here. Third is that we also need to have evidence-based guidelines on care and things like that. And fourth, we also need to have good training of staff and the facilities so that they can remain safe in the care of patients with monkeypox, which basically means we'll have to set up centers where they have the facility to handle patients like this and also not make it a stigma kind of a problem where, you don't want people handling this, but you want to have trained people handling this. So I think there are quite a few areas where they need to focus on simultaneously. But I think it's also important to decentralize so that a lot of this can be done at a local level itself, at a state level at least.
Much appreciated, Dr. Swaminathan. Thank you so much for joining us and giving us that perspective on how to actually deal with monkeypox here in India. Now, we turn our attention to something that Adar Poonawalla, the Chief Executive Officer of the Serum Institute of India, has had to say when specifically asked about the steps that India has been taking to fight this disease.
हम वैक्सीन की सब तैयारी कर रहे हैं और मिनिस्टर साहब को ब्रीफ किया।
सर, मंकी पॉक्स पे कब तक आ जाएगी वैक्सीन?
अभी देखिए हम बेबी स्टेप्स ले रहे, देखेंगे जो मंकी पॉक्स की वैक्सीन ज़रूरत है कि नहीं हमारे देश में, बट हम रिसर्च पूरी तरह से कर रहे हैं, बहुत सारे वैक्सीन कंपनीज भी रिसर्च कर रहे हैं, देखेंगे। थैंक यू।